My name's Tina.
Hi, Tina.
I'm going to be doing a motor exam on you today. Can you tell me what your name is?
Michael Newberry,
Tell me what year it is.
2015,
What month are we in?
September.
And what day is it? Do you remember what day?
I'm going to say the 27th or 28th.
27.
27th.
Okay. I'm going to have you count forward by 4, beginning at 4.
4, 8, 12, 16, 20, 24, 28, 32.
Okay, excellent. All right, so now I'm going to inspect the skin for any kind of lesions, scars, abnormalities. I'm also going to look for uniformity and color. We're going to check temperature. Then we're going to do texture. Check skin turgor. And then we're going to do capillary refill. And also just make a general note about the condition of the nails, fingernails and toenails. Then we're going to look at the hair. Hair is evenly distributed, soft and brown. No evidence of male pattern baldness. All right, where do I go from here? We're going to palpate the scalp. And then we're going to do lymph nodes. So we've got 9 areas. Occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, the posterior chain, the anterior chain, and then the supraclavicular. All right. Then we're going to palpate the sinuses. Any pain or tenderness in the sinuses? Any pain or tenderness? Okay. We're going to do temporomandibular joints, so open and close your jaw. Okay. We're going to do the masseter muscle, so clench your teeth. Okay. All right. And then we're going to do ears, so we're going to inspect the ears behind. And this one. We're going to do some hearing tests. So I'm going to cover your left ear and whisper something in your right ear, and you need to tell me what you hear.
20.
Okay, we'll do the right ear.
40.
Okay, now we're going to do the Weber test with the tuning fork. Tell me if it's equally heard in both ears.
Yes.
Now we're going to do the Rhine test. So I'm going to put this behind your ear, and when you hear it stop ringing, tell me, and then I'm going to move it in front of your ear. And then you'll probably hear it ringing still, and then once that stops, you need to tell me when it stops there. Okay? Stopped?
No.
Okay. You should still hear it.
Go.
Okay, and now we're going to do the other side. I'm not very good at doing this. Okay. We're going to just inspect your eyes, look at the eyebrows, the eyes, the irises, the pupils, check out your conjunctiva, lower and upper. I'm going to palpate the orbital area, any pain or tenderness. Okay, we're going to do a bunch of eye tests. hold this about 14 inches from you and read the lowest line that you can read.
Do I need to cover an eye?
Oh yeah, sorry. Cover the left eye.
The left
Or
eye?
whichever eye. Cover one or the other.
I see 4, 2, 8, 7, 3, 9.
Okay, now do the other eye.
4, 2, 8, 7, 3, 9.
Okay. 4, 2, 8, 7, 3, 9. That's 20/20. Now we're going to do peripheral vision or the confrontation test. So basically I'm going to put my hand out of the field of vision and draw it into the field of vision. You need to tell me when you see it. So cover your right eye, okay? And you just tell me when you see it.
No.
Okay.
No. No. No.
Okay, now we're going to do the other eye.
No. 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 No.
Okay. Now we're going to check your corneal light reflex. Just look straight ahead. Okay. Now we're going to check cover uncover test. So cover one eye. All right. Focus on this. Now uncover your other eye. Okay. Now we're going to do the left eye. Same thing. Focus on this. And then uncover your eye. All right. Now we're going to check the 6 cardinal fields of vision. So just follow the pen light. All right. Now we're going to look for lid lag. So I'm just going to draw it up and down. All right. Now I'm going to shine this light in your eyes, and we're going to check your pupillary response. All right. So, okay. Now I'm going to check consensual response in the left eye. Okay. Check. All right, now I need you to focus on the wall, and then I'm going to put this in front of you, so check accommodation. Focus on this. Okay. All right. Now I'm going to inspect your nose. Any pain?
No.
The nose is symmetric. There's no ridges. Color is uniform with the rest of the face. I'm going to look in the nares. Inspect the turbinates. Okay. Now we're going to do the mouth. So open your mouth for me, please. All right. We're going to look at the teeth and look at the buccal mucosa. Can you stick your tongue out and say ah? Okay. Now lift your tongue so I can look under it. All right. Stick your tongue out and go from, and stick it to the, like bend it to the left and to the right. Okay, and now do the right side. All right. I'm going to look at the sides of your tongue to make sure that you don't have any lesions. Okay, so stick out your tongue for me. I'm going to grasp it with this. All right. Sorry. No lesions. No lesions. All right. Let's take a look with this. Open again. Okay. Now I'm going to look at the neck, inspect the neck for any neck vein distension or any abnormalities, and look at the trachea. Trachea appears to be midline. Now we're going to palpate the trachea. We're going to palpate the thyroid, so turn your head to the left a little bit. Oh, why do you go for the water? Okay, hold this. All right. So turn your head a little bit to the left, or right, sorry, you're right. All right, I'm gonna push. All right, I need you to take a swallow. Oops, sorry. Okay, now put the water in your mouth again. Don't swallow it. Look that way. Not too much. Okay. And swallow. And we're also going to assess the trachea for tracheal tug. Now we're going to go and do the chest, so I'm going to look at your posterior and lateral chest. First, I'm going to inspect the skin, no lesions. Breathing is easy, there's no evidence of retractions or accessory muscle use. We're going to palpate. Let me know if you feel any pain.
No pain.
Okay. I'm going to do tactile fremitus, so say the words 99.
99.
Again.
99.
Again.
99.
Again.
99.
One more time.
99.
Okay. I'm going to percuss. Okay, and now we're going to auscultate the lungs from the posterior and the lateral. Breathe deep for me. Okay, and while I'm on the back, I'm going to check for costovertebral tenderness. Any tenderness? Any tenderness?
No.
Okay, now we're going to do the anterior lungs. Inspect again, no lesions, no abnormalities, breathing easily, no retractions, no accessory muscle use. We'll palpate. Any pain?
No pain.
All right, and we'll auscultate. Breathe. All right, now we're going to move on to cardiac, so I need you to lie back.
This way?
Yep, please. Thank you. I'm going to inspect the precordium for evidence of heaves, lifts, or thrills. I'm going to look and see if I can see the apical pulse, if it's visible. Now I'm going to palpate and auscultate in the 5 areas of the heart, which are the aortic area, which is at the 2nd intercostal space on the right sternal border, the pulmonic space, which is 2nd intercostal space, left sternal border, the 2nd pulmonic area or Erb's point, which is at the 3rd intercostal space, left sternal border, the tricuspid area, which is at the 4th intercostal space, left sternal border, and the mitral area, which is the 5th intercostal space, mid-clavicular line. So I'm going to palpate for any kind of thrills, heaves, or lifts. All right, and now I'm going to auscultate with the diaphragm.